Thank you all for joining. We were waiting there a couple of minutes to make sure everyone had a chance to negotiate WebEx and join us. I'm Matt Stagner with Mathematica. It's my pleasure to welcome you to this second of a series of webinars that are out of the Child Maltreatment Incidence Data Project, which we have recently finished up. Our partners at the Office of Planning, Research, and Evaluation have worked with us over the last few years on this, as well as the partners you will be seeing today as presenters. So thank you to OPRE for the support, and thank you to all of you for joining. Let me kick us off by just going over the agenda for the meeting. If I could have the next slide, please. I'm going to talk very briefly about the motivation for the project. Why did this project happen? What were we trying to accomplish? And then I will turn it over to my colleagues to discuss the overview of this part of the project, the Cross Jurisdictional Model Replication part of the project. We will introduce the site leads who both developed the model and replicated it, and we'll be discussing the findings from that replication effort. And we will try to leave quite a bit of time at the end for question and answers. So if you have a question going throughout the presentation, please send a chat to all panelists, and that way all of us will be able to see that. Everyone should be muted, but we will collect those questions and come back to them and then finish up with thanks and closing remarks. So we have a very brief poll that Derek is going to put up just to help us get a sense of the audience. And so if you see that come up under the Slido event, we would love to know more about who is in the audience. So please take a minute to check the box that best describes your position and hit send, and then we will see the results of who we have with us and hopefully address the questions and concerns of folks from all of these positions. If you hit send, you'll then immediately see the beginning of the responses coming in under the Slido box. So as they come in, we see that many people are other child welfare staff. We have a few child welfare administrators, which is great. A few researchers in academic settings, nonprofits, and a few of our federal colleagues. Interestingly, the largest group seems to be researchers in a non-academic setting, which includes us. So with that, let's turn to the motivation. Thanks to all of you from all of those positions joining us today. We hope to have a lively conversation. This is work that will be continuing, we hope, in a variety of forms. So we appreciate you learning more about it and helping us and the field think about the next steps that we might have. Next slide. So why are we engaged in this? Two key points. One is that the accurate and ongoing surveillance of child maltreatment is a basic necessity to help inform policies and programs in the child welfare systems. In particular, really understanding the extent of child maltreatment, the type of child maltreatment, who is at risk, what the risk and protective factors are, is very necessary to shape prevention and interventions. And I'm sure that's why many of you have joined us today, because you care about how we can improve those types of programs, both on the prevention side and the intervention side. The second piece is that prediction models that leverage linked administrative data may be useful to understand three things: the incidence of child maltreatment, again, the risk and protective factors associated with going through various steps within that system, and the trajectories of child maltreatment. There are many advantages and disadvantages to administrative data. We know that they are sometimes flawed. but in general, they are somewhat easily available compared to other forms of data collection, and they're a rich way, especially when linked across systems, to describe what's happening to the families that we care about. So that's why we set this up. This part we're talking about today is one part of the larger project that was attempting to achieve these aims. And I'm going to turn it over to my colleague, Claire, who will describe this project and lead us into the panel. So take it away, Claire.
Wonderful. Thanks so much, Matt. I'll give us just a brief overview of the project before handing it over to Emily, Jared, and Matthew to talk a little bit more in depth. So the CJMR project worked with 3 different states, California, Alaska, and Kentucky, to explore the differences in the risk of foster care placement using birth record data. So specifically, this project estimated population-level differences in foster care placement risk by applying a single risk prediction model from California to anonymized birth record data in Alaska and Kentucky. And as many of you all on this call know, national statistics from administrative records suggest that there's a significant variability in the incidence of foster care placement across states. And so this project sought to understand the degree to which a model that was built from a population level and anonymized birth record data set in one state could be used to differentiate the risk of foster care placement in different jurisdictions. This model uses birth records to explore whether a uniform set of characteristics can consistently predict foster care placement. And it's important to note that the model is not designed to identify individual children who will experience maltreatment. Instead, it aims to use prediction methodologies to understand the population-based risk of differences in foster care placement amongst children. This project took place in 3 phases, as you can see here: development, validation, and replication. First, in the development phase, the Children's Data Network developed a model using recent birth data from California. Then this model was validated using 2 different out-of-sample data sets, the first being children born in California more than 2 decades ago, as well as data from Allegheny County, Pennsylvania. And then finally, the emphasis of this project was replicating these findings in Alaska and Kentucky, to understand the generalizability of the model and the ease with which the statistical program could be used to code a common set of birth record predictors. Specifically, we sought to address 3 research questions. First, can information recorded at birth consistently predict risk of foster care placement? Second, can a model that was developed or trained using data from one jurisdiction be used by other jurisdictions? And finally, what opportunities exist for using birth record models to help inform ongoing and accurate national surveillance of foster care placements, which is to say, can these models be used to understand differences in foster care placement across counties and states? Now I will hand it over to Emily Putnam-Hornstein to discuss each of these phases in more detail. Emily?
Terrific. Thanks so much, Claire. So I'm going to just briefly give an overview of how we built this model. I want to first kind of confirm that the purpose of this project was largely exploratory. So I am not about to share with you earth-shattering insights, but I think there are some important findings that emerged through this process. So the first thing that we were able to do through our team at the Children's Data Network, and that consisted of researchers at the University of Southern California, UC Berkeley, Auckland University of Technology, and UNC Chapel Hill, was to use linked and anonymized vital birth record data from 2012 to 2015. So that presented us with around 2 million records for children who were born in the state during that period of time. We were able to look for each of those children who was born at their characteristics at birth. And we were also able to look using linked child protection records to see which of those children had been reported for alleged abuse or neglect and placed in foster care before the age of 3. We chose that kind of early childhood period because it allowed us to explore a model using fairly recent data. Had we decided to use data from 10 years ago, we could have looked at who was placed during, let's say, the first 10 years of life, but we wouldn't have known exactly how it would play out using more recent cohorts. And so the way that we kind of trained this model, for those who may be less familiar with these methodologies, is we were really looking to identify which different predictors in the birth data were most strongly correlated and allowed us to sort out among 2 million children which children ended up being placed in foster care. We built the model using the California data, and then, as Claire mentioned, we had an opportunity to use that same code and to code up the same birth fields in the Allegheny County, Pennsylvania data to see whether the model that we had built to look at the relationship between characteristics at birth and foster care placement generalized well to another jurisdiction. We found that it generalized quite well. Next slide in terms of, thank you. So we found kind of during this initial work that there was a nice generalizability to another jurisdiction. And then what we did is we additionally sought to validate the model by looking back at a much earlier birth cohort from 2000 to see how the model translated to that earlier cohort. Again, this was all very exploratory. But what we were excited about, and I think that many in the field will attest to this, as we think about prevention efforts and kind of investing in communities to make sure that services are available, one of the things we have a challenge around is what data exists upstream of child protection involvement. And so we are very interested in exploring the extent to which universal birth records, which are available in each and every state, could potentially be used to better understand differences in risk so that we're able to better allocate resources and also understand differences that may exist as we see in kind of all of the national data across states that may be attributable to differences in the underlying risk of the population of children versus differences that reflect more of how the system responds to concerns of child abuse and neglect. So now I'm going to turn it over to Jared. So next slide. And I'll have Jared talk a little bit about how we were able to then share some of that code to explore the extent to which the work that was already done to set up the California model could potentially be used by Alaska to understand differences in risk for their population of children.
Sure, thanks, Emily. Yeah, we were lucky to be invited to participate in this project, mostly because we've had some data in existence that was linked up, and it wasn't a huge lift to go out and try to relink the data and get that together. And what was really nice about this is that it was our first time actually taking a machine learning type model that was developed by Emily's team, where we didn't have the capacity to develop a tool like that. We had done a lot of traditional statistical type of prediction models looking at the birth records and how they map on to child welfare involvement and foster care placement. And so when we got this algorithm or this model from Emily, when we looked at it, our research analysts went through it, and there was a little bit of trying to get a familiarity with some of the coding in it and understanding what the purpose and intent behind that. But after a few quick emails, we were able to go through our vital records data. And what we found is that with a few minor modifications related to how education was coded and a couple of other variables that we didn't have available or in the same way that were available within the birth record in California, we modified those just minimally, actually, and was able to have the model run and produce estimates that were then able to be evaluated and looked at, that we'll talk about later on. And so we were actually quite impressed with how relatively easy it was for our analysts to implement this model without any training in machine learning models. So Kentucky now, I think, is going to explain their experience.
All right, thank you, Jared. My name is Matthew Walton, and I'm with the Kentucky Cabinet for Health and Family Services. Let's start off by just echoing a lot of what was just said from the Alaska experience. We, on the other hand, did not have readily linked data. So a big part of our participation in this project, which we were also very honored and very excited to be invited to participate in, was a kind of diplomatic effort, if you will, inside of our own agency. And so because our vital birth records are under the kind of jurisdiction of one branch of our cabinet in the Department for Public Health, and we call it TWIST, is the acronym for our Child Welfare Information Network, which is under our Department for Community-Based Services and their kind of IT infrastructure. There was a little bit of a process of going to both agencies and their leadership to show them the value proposition of something like this. And I think where Kentucky, part of the reason that this was an appealing endeavor for both groups was because Kentucky has been particularly affected by the opioid crisis and by neonatal abstinence syndrome and the involvement of families with substance use disorder challenges in the child welfare system. And so that not only did that have hold a lot of interest for the stakeholder groups in our cabinet, it also meant that the data analysts inside the cabinet had been exposed to the fields that are on each of those relative systems. So when we went to go, even though we didn't have them linked, we pretty much knew what was there when it went time to write up the data use agreements and complete the legal and contractual processes to document what we were doing with the data. And so a lot of what I would say beyond what's already been said, the code ran without much headache for us as well. What we had to recode were some of our race fields. I should say recode, really just format them so that they fit the structure that was in the GitHub site that we were granted access to. And then really it ran pretty well out of the box beyond that. Another field that we did some dialogue with the project team at Mathematica and Dr. Putnam-Hornstein and Dr. Yunhei on was maternal smoking. There's a field on birth certificates that allow physicians who deliver babies to document whether a mother reports smoking during pregnancy. We felt like just because us knowing what we know about our state, that tobacco smoking is particularly prevalent in Kentucky compared to, I guess, especially California, where the model was trained. We don't really have any evidence that not having that field in our analyses or in our data set when we ran the model hindered the output at all. So beyond that, that's really what I would say is that for us, it was a lot of building the case for why this could be useful, why this was exciting to participate in, and then navigating the legal and procedural work to link the sets, and then it ran pretty smoothly from there. With that, I'll hand it back over.
Wonderful, thanks everyone. Now we'll spend a little bit of time talking about the findings from the study. So the three sites will share their findings, and let's start with Emily talking about the general findings overall.
Perfect. And please put questions in the chat, because we are hoping that that this section will be more conversational. We're interested in hearing what we may have glossed over too quickly. So I think that there are a few different findings that in my mind emerged. The first is that it becomes clear to me that from a research standpoint, vital birth records are a really useful source of information when it comes to understanding differences in populations across jurisdictions. I feel like my entire career has been built around using vital birth records, and it was really, really exciting to be able to see that a state like Kentucky, which hadn't historically been linking their birth records, could do that and learn something new about their population through the lens of that population level understanding of which children become involved in the system. I think the other thing that emerged, and it was some of the work that was done during the original feasibility process, was, we did some work to better understand what types of machine learning models tended to produce models that generalized best across different jurisdictions. That is, I think, an emerging area, but as much as not every jurisdiction will have, as Matthew mentioned, the technical capacity or resources to train a model in which they are really looking to use it to kind of better understand the populations they're serving. It's great to know that there can be work that's done in one jurisdiction that can be openly shared and adopted and tested in another jurisdiction. I think that the findings also do reinforce that there are some clear ways where we as a field can think very strategically at a population level as to where we kind of invest in preventative services and home visiting slots. And I think it's exciting to be able to have a data where we can kind of take that broad look and really understand that. So for example, if you think about advocates, they might want to go to the legislature to make the kind of argument for increased funding for a particular early intervention program or a certain number of home visiting slots, and to be able to draw upon data upstream of the child protection system to really make the case for where those funding allocations should be made and the number of slots that would be required, again, at a population level to serve a certain number of children, I think is exciting. I think it's also one of the other things that very clearly emerged, even though I feel like I'm still trying to kind of think through and wrap my head around exactly what the insights are, is that, clearly, even though this model worked reasonably well across different jurisdictions, the patterns of foster care placement in California are different than those in Alaska, and they're different than those in Kentucky. And that's something that we've all known, but I think there are real opportunities to use this universal source of data to better understand some of those differences and some of the bright spots where we might find that despite having a population of children where in other states there would have been foster care placement or child protection involvement, we discover that the rates are much lower. And perhaps that can be attributed to certain investments that have been made in the community. So that's kind of my high level kind of overview of some of the findings that I think emerged through this exploratory work. But I will turn it over to Jared and Matt to kind of jump in with some of their observations of what they found for their states.
Matt, I don't know if you want to do this at the same time, but I'll just jump right on and say a few things. All right, sounds good. So one thing that I was really excited about doing this was we've spent a lot of time in Alaska. I'm located in the Division of Public Health, and so we've been trying to take a public health perspective at child abuse and neglect, which is really about what Emily's talked about, this upstream identification before they're involved with the child welfare system. And so we've built models trying to understand what are these sources that we can use early on in the child's life or the family's life that help us identify so we can target our resources at directing prevention efforts towards them. And so I had done some prior work with Emily where we compared Alaska's rates with California's rates because we both had linked data and we wanted to look at the incidence proportion of first report before a certain age. And what we found is that our populations, as you would expect, are vastly different. And it was really driven by the differences in our racial distributions, where we have a really large indigenous population and they have a large number-wise but small proportionate, and we just look very different. But the research shows repeatedly that there's these disparities in racial reporting and navigation through the child welfare system. And what I was a little bit surprised about with this model was that didn't seem to be an issue with this because it took that into account when it used the data that we had, the distributions, the proportions of our racial classifications to really look at like, well, what's the risk of contact with, or we were using contact, we were using removals, right? Foster care placements, that's what we were using. And I was quite surprised by that it was really able to say, well, I'm going to look within the data that you are presenting to me, your distributions, your structure of your birth population, and based on this model that was trained in a population that looks structurally different from ours, was able to perform well. And it did what I think Emily was alluding to, is it really seeded and confirmed what evidence has been showing that these birth record factors, some of them especially, are really strongly associated with these outcomes. And those birth record factors, those birth factors, that if we look at them, we recognize, we understand that there's certain populations, because really a lot of these factors that we're measuring are proxies for underlying risk factors that we need to be addressing. And they really can help us target within our state or in our local locale with our births where we may be able to identify and focus some resources to help populations on that trajectory when they have a new birth come into their home. So that just kind of it validated, it confirmed, it surprised me a little bit because of the prior work we had done, but it also confirmed that these many of these factors we're looking at are universal across populations, but they can help us target. So I'll turn that over to Matt. So.
Thank you very much. I'll say too that one of the things that I think Kentucky's experience illustrated for me and for the team that I work with is just how, this is sort of a tired point, but it's hard to implement in practice, is that the patients that government agencies serve, especially health and human services agencies serve, don't live in these silos. Once a baby is born, if that family has a need, they may receive SNAP benefit, they may need childcare, they may need to see a pediatrician. And even though we sort of house these services in these siloed off agencies, when you are able to link data like this, you're able to see how they move through all of these artificially siloed off services that we use. So what we were able to do was to kind of almost build a bridge between our public health agency, where the birth records originate, and our child welfare agency, and really stitch together the point that Emily made, that if these issues or variables are relatively sufficient indicators of later placement in foster care at birth, then we have a program that's a nurse home visitation called HANDS. It stands for Health Access Nurturing Development Services, but it's even really developed to be started prenatally. And we thought, well, maybe there's some future where this model that works well enough could help identify where HANDS is being underinvested in parts of our state. Where maybe there's a policy question that gets floated. What if there was a universal access to HANDS? And in theory, there is, but the state knows that if every expecting family used it, there wouldn't be enough supply. So the other thing that I would say too is that this effort for our state dovetailed very nicely on work related to the Family First Prevention Services Act and the implementation of that set of policies, which are targeted at preventing placements in foster care. And so if you have tools that help you identify, well, who's at risk of being placed in foster care, you have another application for this kind of approach to understanding the sort of public health framework for child abuse and neglect.
Thank you. That was very helpful. Matthew, while we have you on the line, can you, you mentioned these diplomatic efforts were a major part of this project for Kentucky. Can you tell us a little bit more about how you all had to navigate the legal and privacy issues in Kentucky?
Sure. Yeah. One of the things we did encounter the hesitancy about when you say machine learning or predictive analytics. Some people will hear things that, you know, this project didn't actually propose. Like, is it going to be sorting who gets a service or who doesn't get a service, or is it going to be directing workers to investigate cases of alleged maltreatment? And that's, as was stated earlier in the presentation, that wasn't the purpose. So we had to do a little bit of reassuring people that this was for the purposes of, you know, this is way upstream of any kind of direct application in practice, which helped a lot. I think really, just like any kind of diplomatic effort, there was credibility there was a sense of trust among the people at the table that we had worked together before. We all kind of had a sense of shared goal and a level of kind of assumed positive intent from one another. And then the last thing we would do is we had actually done other work with, that was a federally funded project related to linking records, and we had learned quite a bit about our own laws. And so that would be perhaps one thing that I would call attention for those in the audience, is that I did not fully appreciate the depth of privacy and confidentiality and data sharing. And we have an entire division of our team devoted just to that, because I came from the healthcare world before I did this kind of research, and we have HIPAA, and, you know, people grumble about HIPAA, but it is at least very clear, you know, what you can do with it, with health information, what you can't. I have found that child welfare information does not have the same degree of prescriptive protections for data, and it's very state by state. I mean, we have CAPTA, which gives sort of broad authority to states for how to use this data, but then from one state to another, it can differ a lot. So we wrote a brief that we published with Academy Health with some of the things that we learned from that level of legal analysis. And we were able to take that and apply it here. And that gave us another kind of good head start.
Wonderful. Thanks so much, Matthew. I have one final question for Emily, and then we'll pass it over to Matt to do some more broad questions and answers. Emily, can you talk about what the next steps are for this model?
Sure. So, I mean, we view this as just some kind of initial exploratory research work. All of the code that we have been discussing is posted on GitHub, which is a repository. So if other states or researchers or jurisdictions are interested in going in and looking at the 82 predictors that were coded from the birth record data, or trying to explore how they can run the code on their, again, anonymized research data to look at the population of children who, at least in California, would be have more of a concentration of risk factors for foster care placement. To me, that's really exciting to just think about kind of opening up the code and the research so that this can be more of a collective effort. Certainly, some of the work that we're doing is to just better understand. I saw one question in the chat box, you know, what are some of the features that might show up as kind of important predictors in one jurisdiction versus another, and what does that tell us about potential population differences or differences in how the system responds? So that's where I feel like, I guess maybe one final finding that emerged from this project is there are lots of opportunities for sharing code without having to share data. And that I say broadly to the research community who's on this call. because, you know, our team at the CDN, we never looked at or saw any of the kind of confidential data that Jared's working with. We never looked at or saw any of the confidential data that Matt was able to work with within Kentucky. But what we were able to do was to share enough code that we could really have kind of this collaborative effort across 3 states that I think is in some ways a nice model for the type of policy and applied research that can and should be taking place across states as we move forward.
Wonderful. Thank you, Emily. And with that, I'll pass it over to Matt to ask some questions and answers from the audience.
It's a lot, Claire. And I'm going to selectively pick some of the many questions we have, but please, if you have other questions, put them into the chat and we will try to get to them with the 20 minutes that we have remaining. So the first one, which I think, Emily, is not a surprising one to see, but I am thinking you might be my first target for addressing it, though Matthew and Jared may want to jump in, is you mentioned that the goal is to identify how better to target supports, but could this also be used to surveil families and communities and end up increasing contact with child welfare systems? What are the opportunities for transparency and how the model is used or not used? So Emily, if you could just kind of address that more generically, and then maybe Jared and Matthew could address it from their particular state positions.
Yeah, so I just want to kind of acknowledge that there is always the risk that work is translated poorly by the field. I don't, you know, I think that what we're talking about in the context of this project was really just an epidemiological project where we were trying to say, if we have all these differences that we observe in the incidence of foster care placement, the incidence of reporting, what is that one common data source across states that is upstream of that involvement with the child protection system, which might help us to better understand where those differences are emerging. And then I really do think that the opportunities lie in how we then translate those insights into smarter investments in prevention and early intervention. So, you know, I would welcome kind of Jared and Matt jumping in, but that's very much how I think about what we learned and what the opportunities are with birth data.
Jared or Matthew, do you have something to say from your own state's perspective?
Yeah, I just, the perspective I want to bring on, I saw that comment too in there, is that I think there's a fundamental shift that's been occurring in child welfare when I've seen things littered throughout literature saying taking a public health approach, and Emily is offering a public health approach that takes a population-based data source to make inferences about that. But just like the question, the survey that was on this, public health professional was not included as an option to click on. And so I think that's really a needed area of ensuring that those partnerships are really symbiotic, that they're really well developed. Because what can happen is that public health authority in each state grants some data capturing and use and utilization that maybe isn't well articulated, that Matthew pointed out within the child welfare law, that could allow the surveillance of populations for public health purposes, that kind of removes that kind of jurisdictional type of child welfare potential reporting thing on it, and it can allow the home visiting type stuff. It can allow that public health model to really be adapted into, yes, targeting and identifying families that could utilize public health services early on to prevent not only child welfare involvement, but increase education performance and a variety of other negative health outcomes. So I think that these models absolutely have to be transparent in how we're utilizing them, but it's also, we need to ensure that we're working with our partners to make sure that we're using them appropriately as well.
The thing that I would add to that too is I think throughout the team in Kentucky was very conscientious that the approaching this with the public health lens lands squarely in our understanding as well. I think where we were trying to be careful about maybe over applying that for ourselves was, let's say that you are like COVID as an example. Our group helped support the state's COVID response to the COVID just by taking laboratory data and making it useful for our public health authorities. Well, a laboratory test is fairly, I mean, a COVID virus is present or it's not. It is a biological reality. Whether or not a child is removed from the home is not a biological phenomenon. You know, it's maybe has components of that if a child has been severely injured, and there can be clinical records present. But, you know, I'm sure this audience is, you know, you all have probably published to this effect, you know, that we know that bias can enter that equation, the level of experience of the worker, the quality of the information that's being used in the court. All of these things are affecting whether or not there's a 0 or a 1 in these outcomes that our models were run on. And so I think all of that is just to reinforce the point that that this is an epidemiological exercise at this point. We're going to use a public health framework. What we have are the public health tools that are available, the same way that, you know, would study the prevalence of a cancer or a virus. And we're at the mercy of the quality of the data and the way the data is produced, all the while knowing that there were injustices or unfairness in that data. And so I do think that there's just always going to be that tension and that philosophical kind of debate we have to have with each other. These are powerful tools. How do we always make sure that they're used in ways that help people and don't exacerbate harms?
Thanks. I have a couple of somewhat particular questions. I think I'll go to those before going back to some of these very large view overview questions. So one is, how did the actual model perform, and was that consistent across multiple states? So without getting into the details, we've tried to kind of keep this conversation at a less technical level. Can one of you give a summary of how you would describe to a lay audience the performance of the model and the consistency across states?
Sure, I'm happy to take a pass at that. And there's information in the brief that's been released as well as the technical appendix. But the way that we tried to present data and, you know, across jurisdictions is we looked at the California model and we said, if we kind of identified the 10% of children who were born in California and the model thought were at highest risk of foster care placement, and we offered each of those families intensive home visiting in a voluntary fashion, how many children who would, you know, we know from the data ended up in foster care, would we end up serving through that approach? And when we looked at the California data, we're taking that top 10%, and what we found is that we would have served, I think it's almost 60% of kids who ended up in foster care by the age of 3. When we used that same strategy and we looked at Alaska and we looked at Kentucky, we found that using that same approach, we would have reached about a third of children who ended up placed in foster care. So we definitely found that the model did not perform as well in kind of Kentucky and Alaska as it did in California, which is understandable. But we put forth data where it's, again, really intended to think through those questions around who's being served. And we do present kind of the area under the receiver operator curve and information in GitHub so that if a state wanted to run that model and look at the metrics for their data, they would be able to do that.
Thanks, Emily. And I think I will also, for a couple of other questions, refer folks to the documents that are now available, the brief that Emily mentioned, as well as some of the more technical documentation around how each state had to adapt. We think of birth records as being a good source for this because all states have somewhat the same model of a birth record, but this showed what we did expect, which is that it's not exactly the same, and each jurisdiction needs to make some adjustments to the model, but we did not see those as undermining the model itself. I want to address a question which I think is probably on other people's minds as well, which is, can a model like this, is it meant to talk about the incidence of child maltreatment, which again, back to my framing of the origins of this project, and as Emily very clearly stated, the outcome of interest here was placement into out-of-home care. Emily, I don't know if you want to talk just in sort of larger picture terms around the choice of modeling that outcome versus, say, long stay in care, something that would be even sort of more intensive, or a substantiated report or a call to a hotline. How did you think through that and come to focus on foster care placement as the focal point of this project?
There was some preliminary work done where we found that we were able to build models that had much greater classification accuracy when we were trying to identify something that we call maltreatment that was severe enough that there was a removal of the child and a placement in foster care. So we found that that was a much less noisy signal to train a model to predict than some of the other things that are inherently either driven by statute and what kind of gets called in, which would be the referral piece or substantiation. So that's how we landed on foster care as potentially, especially during early childhood, maybe a more reliable indicator of concerns around abuse and neglect that were pretty significant.
That's helpful. And I'm going to come back to you for one more question, though I would like also to have Jared and Matthew chime in if they might. But can you talk about the community engagement piece, or especially the reason I don't want to go to Jared and Matthew is, to be fair, we gave each of you very limited time to use available data and work through this process. And that's because that's what we were able to do in this project. So I'm turning to Emily to really describe the development of the model and the people who were involved in, or how discussions at the community or agency level worked with that.
Yeah, so I think the important thing to remember here is that this was a very small, minimally funded, quick turnaround research project. Certainly, if any jurisdiction were thinking about using a model such as this to really make some dramatic changes to how investments were being allocated across communities, I think you'd want many other people at the table. But what we did is we basically built on kind of collectively the conversations that I've been having with different communities around the use of these methods in child welfare going back, I think, over a decade now. And for the purposes of this project, it was really just to first answer the question, is it even possible to use a model trained in one jurisdiction and apply it to another jurisdiction, knowing that there's a whole lot of information that can be generated if that's true, but we didn't know if it would be.
Some of the questions in the chat relate back to the ultimate purpose of this and the goal of helping children and families, which I do think is at the heart of the motivation for this project as well as the ways in which it was carried out. And I would say, and ask the panel to respond a bit, that a lot of this comes down to the fact that as a society, we do not necessarily put forward all the services families at birth might need for all the families that might need them. So one way in which this can be helpful to both states and systems, but also the families themselves, is around as we talked about it in public health terms, kind of a geographical perhaps, or subgroup availability of defining who should be available for a service. I think Emily used the word voluntary several times, quite purposefully, that the idea would be where services might be made available as opposed to actually required of families. But Jared, do you want to take the first kind of crack at that with the public health framework in mind of how could this type of knowledge, not necessarily this model used in this project at this time, but if we were to develop this further, really be used toward the benefit of children and families, which is our ultimate goal.
Yeah, happy. I'm sorry, I'm watching the chat come in. Hopefully we're documenting that. That's fascinating to see because it's really the things that have people really interested on developing where this goes. Um, you know, just to preface this, one area that we're really excited to further this work or continue on with things that we have planned to do is that we've linked other data sources in as well, some that measure the pre-birth period a little bit. And we can look at the household challenges and things that are experiencing there. And what we're interested in doing is seeing like, well, how well does the model, if you just take the birth record, do compared to if you inform it a little bit more? And all of that, from being centered in the Division of Public Health here in Alaska, is really about identifying families that could utilize some additional services and be offered additional services to help them on this journey of raising a family. And when we think about supports and providing to that, the nice thing about this is that offering supports of what we're talking about, whether it's economic supports, whether it's substance abuse supports, whether it's mental health supports, whatever they might be, are positive things for families. If you're offering them to them, not requiring them to do those things, there's not a big risk in making those offers to people. And so if you can help clinical providers, or if you can help people that interact with those individuals in that early period to be able to identify and sift through the variety of different populations that they're dealing with on a regular basis, to maybe target them to leverage and utilize our really minimal resources and get them funneled into the places that might help them the best. Any of those types of decisions are going to be really helpful potentially for the population and families that are coming in. So instead of society saying, we're going to require you to do this so you can raise your family, we're going to say, we want to help offer you these opportunities and supports to you to help support you on your journey to grow your family. So that to me is why I kind of mentioned back up is getting child welfare and public health to work together, because the framing of how those things apply there, and definitely the messaging, like prevention with messaging with someone who could potentially take your child away from you is kind of hard for the general population to accept. But a public health nurse who doesn't have that authority, I mean, could make a referral. It just can be received differently from the potential consumer. So I think that's why that's important to bring it in and how it could be used in the future, and why Emily's been beating this drum for a while about utilizing these birth records and identifying these populations, because it can have that message. So that's just my perspective on it from one state.
I would love to end there, but I also want to give Matthew or Emily just a chance to build upon that great statement. So Matthew, do you want to go first?
I'm sure, and I can go quickly. I have to admit that I have like sort of such a heavily pro science bias that it's hard for me to sometimes see through it, because so like if I'm being seen by my doctor and someone says, our office is doing a study on X condition, would you consent to have your laboratory results sent for the study? I say yes. I don't even really need to hear the details of the study, because I want to conduct science, but I also want to be a participant, if that helps someone else's project. So that's a bias, I admit, and not everybody feels that way. So if someone doesn't feel that way, I certainly understand. What I would offer, I hope, is helpful in the question, because I think it's a very serious one, that the child welfare system has skeletons in its closet, and there's been ways that it's been used unfairly and to harm communities. And I think they're justifiably saying, like, we want our children to be safe, but we don't want you to invade part of our privacy or misunderstand things that, we just want to preserve the sanctity of our families. And so what it calls to me is maybe a bit of a stretch, but it makes sense in my mind, is a little bit of that episode that Dr. Anthony Fauci weathered with the HIV and the advocates in the sort of 80s and early 90s, when the ultimate reconciliation that the sort of federal scientific apparatus and the advocacy were able to, is when Dr. Fauci started coming to their meetings and listening to them. And the message that there was, at least from the documentaries I've seen about it, was they were saying, we just want to be involved. Like, when you develop clinical trials, make sure that enough of us are represented in the trial that we can, appreciate the findings that you have when you go to develop a drug, and just listen to us. And because we think that eventually the treatments are going to come out of these labs, we just kind of want to have a stake in it when it does. And I think this is analogous to that, that these methods are something akin to the development of treatments for HIV in that case.
Thank you, Matthew. Emily, very short final word.
Final word is I think that there's that question of how does this benefit any individual child or family versus how does this benefit our efforts to really reorient our systems to be more prevention focused. And as Jared pointed out, we clearly need a source of data that will allow us to do a better job. And to me, this seems like a pretty reasonable place to start. So, and hopefully children and families at large will benefit from better coordination and more thoughtful investments in prevention in the areas where it's most needed.
Thank you. Well said. And thank you to the audience. If I could get to the final slide. I appreciate everyone being here for the last hour. This is the beginning of something. This was not an effort to start and finish. We're starting down a path. We would love to stay in touch with all of you and continue what in the chat has been an important conversation. So for additional information, here are listed our OPRE project officers, and our thanks to them again for working with us over the years on this, as well as my own contact information. I'm sure Matthew, Jared, and Emily would appreciate continued conversation as well. And again, with our goal of improving these systems and improving the lives of children and families, we hope that this had at least a small step forward and one that we can build on. So thank you for taking the time and appreciate it, and hope to see you again in a setting like this soon. And thanks to Claire and our team, and especially our panelists. Thanks.